Arcadia stood out to me among other physical therapy programs just because I knew that the best of the best was here. They provided you the research opportunities. They were well published. Everyone in this area and nationally and internationally, for some of our faculty, knows them.
I chose Arcadia University for a variety of reasons. One of them was first the case-based curriculum, which I think is unique and innovative and you don't see a lot, and helps us to really integrate all of the systems that a patient has.
Right from the very start, we get the students thinking about the patient, thinking about all the aspects around decision making and caring for that patient. So really early on, they're thinking about how to take content and make a decision for the patient with that whole patient in mind. They're not starting out learning just about basic sciences and then later on applying it. They're applying that right from the very beginning.
The physical therapy program here at Arcadia University offers students an outstanding educational opportunity. Our faculty are highly qualified and our curriculum is highly integrated, meaning that we teach students to think about the patients as a whole person rather than as body parts or disease processes.
The faculty at Arcadia are all great and experts in their respective fields, and there's a lot of very different backgrounds. From the very beginning, it's not really like a professor-student relationship. They're really try to interact with us as peers, which is really beneficial because it's not like they're in some elevated position where we're just students and they have to try to teach us. They really want us to do well once we get out into the field because they know the end of this isn't just for us to be students, it's to get us to be clinicians.
They have a lot of really great access to all the experts in the field outside of the school, so they do an awesome job of bringing in clinicians that are the top in their field. They're bringing in the people from the community to make sure that not only are we receiving the best, education from them, but also connecting it to the clinic as well, which I think is really important in becoming like a well-versed and well-rounded physical therapist.
I think one of the things that makes our program stand out is we have experiential learning for all of our students. That's done nationally, so it's done locally, and then for some that choose an elective, we have international experiential learning options as well. And I think when you look at all the experiential learning opportunities that they have brought together, we're pushing them outside their comfort zone. So they're trying to learn from people that are different than they are. They're trying to experience a wide variety of the general population, and it challenges their assumptions about what they think people can or can't do based on a given diagnosis.
At Arcadia University, they really emphasize service, and they emphasize that PT isn't just a job to make money, but it's a vocation, it's a way to serve the community and the population by improving societal health and improving individual health.
The value of having a background such as we do and being prepared to travel internationally to help people is something that is very unique to Arcadia. They talk about their international connections not only at the undergrad level but at the graduate level, and they really work hard to integrate those two things even into our physical therapy education.
The curriculum is designed around 23-week units or modules. Each of those units focuses on principles that are key to physical therapy practice, and then have specific case examples so that the students again can start applying that information. And we build from simple to complex, so the earlier units, so units 1, 2, and 3, have more basic and simple concepts that have to get across to the students. And then we start to build on those concepts and make them think a little more detailed, and the patient examples become a little more complex.
And because it's case-based and we don't have these individual classes, we don't really have many textbooks. And so the professors are constantly combing through the latest research to create our presentations and our lectures and labs. And so everything that we do is based on like this year's evidence, and it's not a textbook from 5 years ago that had evidence from 5 years before that, but it's all the latest stuff. And we're taught to critically analyze that. And so when we're out in the clinic, we know how to read the research and we know how to keep up to date and keep pushing PT forwards.
The benefit of having a dual degree, having the physical therapy degree and the public health degree, allows me to have that appreciation for what is happening at the systems level. What are the policy changes? How do they affect me? How do they affect my patients? How do I provide the best care? And those two things together, I think, are so unique and something that I greatly value now as I enter into the work field.
We have a really special community here that's a partnership between students, faculty, and staff. I hope you'll come experience it.